Hello and welcome. I want to thank you for taking the time to learn a little more about Oculus Health's turnkey chronic care management solution. Today, we are going to be going through the software that our care managers use while conducting the 20 plus minutes of non-face-to-face care, how it's the experience that your patients have, and also the interactions that it has with you and your organization. I am John Lustig. I'm the Director of Business Development, and this is on behalf of Melissa Conley, our National Sales Representative. So let's go ahead and get started. What you're looking at right now is the provider platform. This is where our care managers conduct the 20 plus minutes of non-face-to-face care. Before hopping in, I want to really paint the picture of the interactions that we have with our patients. It's very unorthodox. We believe in one-on-one relationships here at Oculus. The care manager who calls the patient the day after they sign the consent form is going to be that patient's point of contact from that point forward. They will have a direct line to them anytime they need to get in contact, and it's really having an accountability buddy. It has worked extraordinarily well for us. We limit our care managers to managing 500 patients. That is well below even the low end of the industry average of 2 to 3,000. But we find that after 500, the patient experience starts to really kind of drop off, and so that's why we do it. We do it that way. One of the things, when you look at how the 20 plus minutes of non-face-to-face care is conducted, Oculus is incredibly unique. And I think it really can be boiled down to the fact that we realize better than anyone that patients don't have to do this. If you don't make it valuable for them, if you don't make it engaging for them, they're not going to. The mentality of get them on the phone for 20 minutes, keep them on the phone for 20 minutes, as soon as you hit 20 minutes, hang up, call them back next month, has really crippled the ongoing engagement component. At Oculus, we have an attrition rate of less than 1%, which I think speaks volumes about the quality of our program. Once patients get on our program, they stay on our program. And that's just incredibly a great compliment. We average 4 touch points per patient each month. And really to paint the picture of how we approach things and that there is no one size fits all in terms of how we interact with patients, I am fortunate enough for demonstration purposes to have both my father and my grandmother on the platform. My father is 66, retired math teacher. He has a glucometer, blood pressure monitor, and a Fitbit. As soon as Megan called him the day after he signed the consent form, she goes, "Joe, perfect, I see. What is the make and model of your glucometer?" Now, my dad didn't know this, but it was Bluetooth enabled, but he didn't need to know that. Megan knew that. She goes, "Perfect. Can you press this button, this button, this button? All right, what are the 3 numbers on your screen?" Perfect. Now, I can see every single time you check your blood sugar, you don't have to do anything special. I'll automatically get the update so that way I can monitor it. Same thing with his blood pressure. Same thing with everything that his Fitbit tracks. Also, my dad logs his medication adherence on his app and his profile every single morning. It's the first thing he does. I think it drives my mother bonkers, for lack of a better word. But when you look at it, my mom said that my dad used to forget to take his medication once every 4 or 5 days. He hasn't missed a single day this year. We have a rewards program where he gets 25 points every single time he gives us a data point, such as saying, "Yes, I took my Synthroid today." And I think he has made it his new part-time retirement job. 55% of our patients interact with their app 2 or more times a week. We have 2 primary goals. The first is to get patients actively involved in managing their own health, and that is really where Oculus excels. On the other goal is to identify problems before they become problematic. And I'll get into how we do that very effectively in just a minute. But first, on the total other side of the equation, there's my grandmother. She does not believe in cell phones. She does not believe in computers. She and her care manager, Sarah, have 2 calls a week. Every Tuesday and Thursday, 8 a.m. Eastern Time, like clockwork. Because that's how this program can work for her. Whereas my father, because he's constantly communicating with Megan, he has a call every 2 weeks. At the end of his current call, they'll schedule one tentatively for about 2 weeks out. That's how we approach this, because how can this program work for patients? That's the only way it's going to work for anyone. So now that you know how we go about conducting our interactions with the patients, I am going to act as if I am one of our care managers starting my day. The first thing I do is I look for the patients who have the calendar icon with the X, who have not logged in recently. We do not let patients go more than 7 days without having some sort of correspondence with us. For my dad, he's corresponding all the time. Every single time he checks his blood sugar. He actually went on a cruise a couple of months ago where he was going to be out of the country for 12 days and completely disconnected. And he was well aware of this 7-day rule. And the funny and sad thing is that Megan knew that he was going on a cruise before I did. Because he's like, oh, I don't want you to worry. By the way, I'm going to be completely out of touch. So when I show up, it's 7 days with no correspondence, it's going to be fine. Megan told me that my parents were going on a cruise, which is a little embarrassing as the son, but it speaks to how beautifully our program works and the relationship that is established between our care managers and the patients. Next, we identify patients who have not been following their care plan. The best way I can describe what it is that our care managers do is we do not treat, we do not diagnose, we do not alter treatments, we do not alter diagnoses. We do care plan oversight. So based on what is within the patient's chart in the EMR, we ensure that they are adhering to those treatment instructions, taking their medications. Sometimes we will supplement only with provider permission, and the types of things that we supplement are Mayo Clinic evidence-based best practices, such as for type 2 diabetics. It's an evidence-based best practice that exercising 30 minutes 3 times a week is very, very good in helping you manage your type 2 diabetes. For things like that, where it's more of a personal health change, such as diet or exercise, those are the only areas where we really supplement. Everything else comes directly from the EMR. If it falls outside of what is within the EMR, we bring them back in to see the provider. That's how we catch problems before they become problematic. Megan is always monitoring my dad's blood sugar and his blood pressure. If blood sugar starts to destabilize, she will catch on before he ever would think to, and bring him back in to see the provider with the reason and the supporting data as to why he's there. Also, because we become the first point of contact for patients enrolled in the program. We keep the patients who may or may not have stubbed their toe out of the office, and those who have a tendency to, let's say they have blood in their urine. Like, oh, I'll give it 30 days and see if it goes away, and if it does, then it's like it never happened. That's not okay. Our care managers make sure that they come in. So when you log into a patient's profile, the first thing you see is a task list. We will do anything related to the patient's health and or wellness. One example of something is, I can't tell you how many thousands upon thousands of patients we have signed up for Meals on Wheels. Is that a CMS billing requirement? Absolutely not. Does it add value and contribute to the patient's overall health and or wellness? Beyond a shadow of a doubt. So therefore, we're more than happy to do it. Last call note, a little more comprehensive than this generally. Peter's not real. But if you ever want to know how the patient is doing, the last call note will really paint that picture very clearly and concisely. Call schedule, as with my father and grandmother, it's on a case-by-case basis. How can this program work for the patient? Care plan. Care plan consists of anything from diet, exercise, medications, appointments, etc. This is where Sarah, when she's on the phone with my grandmother, is going through, Helen, have you taken your Synthroid? Yes? No. Okay. How can we make sure that we are better about this if you're not taking it? We need to increase the frequency of calls. Conditions, all pulled directly from the EMR. Overall care strategy. This is where we would supplement with things such as lifestyle changes, type 2 diabetics, exercising 3 times a week for 30 minutes or more. And also, looking up the activities at the senior center to make sure that the social and psychic needs of the patients are met. Care team. This is one of the most often overlooked billing requirements, is sharing the care plan electronically with all members of the patient's care team. Every provider they're saying, visiting nurses, etc. It has to be done in a HIPAA compliant way, electronically, fax does not count, email does not count. CMS was very, very clear on that. This technology did not exist until a couple of years ago, and it's very expensive. So we actually built our own. And as you'll see in the upper right-hand corner, it says you're currently recording time for this patient. As soon as we got into Peter Samuel's profile, that timer started. Every single thing that our care managers do is done within this platform, including calls, and we also have video call capabilities and TCM capabilities. Every single click that is made, every call that is made, every word that is typed has a timestamp. That is why we can guarantee that you will successfully pass a CMS audit. And we do guarantee that you will successfully. We'll even engage the auditor directly because we can say down to the second what we spent the 20 plus minutes of non-face-to-face care on. Our documentation is utterly flawless. You know, providers actually take two oaths. One is do no harm, and the other is don't do anything that could possibly get you in trouble with CMS. And we take the second one very, very seriously. And I always get asked the question, what happens if the care manager gets up and goes to lunch? If the cursor does not move for 1 minute, then the timer will pause and erase the last minute. Again, we don't believe in playing with fire. We pull the patient's entire health record. This is not so much for our benefit as much as it is for the other providers that the patients are seeing. Care plan is going to look oddly familiar to what we saw on the dashboards because it's the same patient. And instructions, apply care profiles, settings, health tracker. We're going to go into that on the patient side. That's where things get very powerful in my opinion. Call notes, HIPAA compliant messaging is also a requirement, and call notes is just a historical log of all the call notes. All right, with that, we're going to hop on over to the patient side. When a patient logs in, this is what they see. First thing we do, and 55% of our patients, just like my dad who logs in every single day and logs his medication adherence, 55% of our patients, including patients like my grandmother who haven't even created a profile, log in and interact with their app 2 or more times a week. That is unheard of in healthcare by a factor of 5. The first thing we do when patients come in is we ask, how are you feeling today? Anything below 3 stars generates a pop-up. Sorry, things aren't going better right now. What's causing the trouble? These are not random. I've obviously given Peter Samuel many diagnoses for demonstration purposes. I probably need to clean that up. But these conditions are pulled directly from the EMR. These are the conditions that Peter Samuel has. These are the areas that they're working on. Backache, tracking mood, migraine, smoking, etc. So you can indicate what's wrong. You can say, I want help or I don't want help right now. If a patient indicates that they want help, they will show up on the care manager platform as an acute patient. They move to the top of the calling list. We say that we will call within 1 hour. It's generally about 5 minutes. Next up on the health tracker. There we go. Anything that can be measured can be tracked. This is where some of our reward points enthusiasts get very active and involved. But anything that the patient and care manager decide to work on, any goal they set for migraine, let's say that they started a new migraine medication, then the care manager will check in over the next several days and say, how is it working? Is it working as intended? If it's not, patients often, they just discontinue using it. That's not okay. We will bring them back in saying that it's causing these side effects. Patient was going to stop using it. Also, they're still experiencing extreme migraines. Link sources. I told you my dad likes to think he's tech savvy. He types with 2 fingers, by the way. But he synced his Fitbit up in 15 seconds. That's how easy it is. When you create or set up your Fitbit, you create a username and password. All you do is enter it, hit login, and then anything and everything that the Fitbit ever tracks will be pulled in a nice, visually appealing, easily digestible manner like we just saw. We integrate with more than 300 medical devices, wearables, apps, you name it. If it's Bluetooth, Wi-Fi, or GSM chip enabled, odds are we have built a way to integrate with it and be able to see all of the data that it pulls in real time. We also are integrated with more than 900 hospital and health system EMRs. So Beaumont, one example, here in Michigan, is one of the major health systems in the area, if the patient has been to any single provider within the Beaumont ecosystem, all they have to do is enter their username and password for the Beaumont patient portal. We can help them create the username and password, and then we can pull all the records that have ever been captured at Beaumont. Care plan. This is where my dad goes, and he logs his medication adherence every single day. And every single time he does, he gets points. And here is, when I first saw our patient reward program, I thought, this is kind of cute. I was utterly shocked when I heard how many bouquets of flowers, gift cards we've given out. My dad kind of appeases my mom by saying he's saving up for a Dyson vacuum. This is an incredibly well-used tool that is also another significant contributor to our ongoing engagement rate. All right, well, that sums it up here on this end.